So I'm here at ACTRIMS-ECTRIMS to talk about the impact that the internet can have on clinical research for patients living with MS. I think a lot of people have fears about the internet, that it can be a source of misinformation or cause people to just develop their own anecdotal experience and not really go to the data. What I'm here to sort of share with the audience is that the internet's really changed over the past few years, and it's evolved from a place where people just tell stories to one another to a place where people can actually share data. And the type of data that they share is patient-reported outcome measures, the same types of things we use in clinical trials. Patients are increasingly getting access to powerful web-based tools that means that they can aggregate and pool together pretty reasonable observational data, actually. And so it's no longer just the case that, the plural of anecdote is not data, that they are actually entering in data and making judgments and sometimes even doing statistical research on their own. And so what I'm hoping people will do is maybe just change their perceptions a little bit and go and take a look at what's out there and how things have really changed over the last 2 or 3 years. So I think one thing that's really useful is to take the patient's perspective. Go and type multiple sclerosis into Google and see what comes up. You'll see information there on Wikipedia, which actually has sometimes been shown to be about as accurate as medical textbooks. You'll probably see forums and leaflets and information that come up from the MS societies, many of those leaflets written by colleagues that are here. I think the next level down and where some of these concerns come across is when patients are talking to one another. And in particular, you've got to separate out two things. One is sort of fake stories that come around by quacksters and scammers and fraudsters. I think as people have got more familiar with the internet, everyone's got a lot more sensitive to the fact that these things exist. So for instance, now if you get an email saying it's from a Nigerian prince that wants to offer you a big wire transfer, you're a little bit skeptical now than people maybe were, say, 10 years ago. It's the same thing online. The second group is of patients saying that, well, my doctor prescribed this drug for me. That doesn't necessarily mean that drug is suitable or available for other people. Certainly one of the things we've tried to do at Patients Like Me is encourage people to share what's worked for them, but never to say, and so you should do this too. Because what the patient doesn't always have access to is some of the other information around. Perhaps there's a reason due to side effects or other issues or contraindications of other medications people are taking that those patients may not know about. That said though, I think there's nothing wrong with patients asking questions. I think a lot of the time, there's so many new treatments out there. If the patient didn't ask questions, sometimes they wouldn't always get the best care. I know many of our colleagues here are specialists. Most patients don't see specialists, and sometimes not every general neurologist, for instance, will be fully up to date on what is the latest disease-modifying therapy. So sometimes it's fine for a patient to really prompt that question. Yes, it does require a few more minutes of education, but frankly, I think that patients deserve that, and it's more about perhaps us thinking about how we reconfigure our service to meet their needs than just to shut the conversation down and say, well, don't go on the internet, because that's not going to happen. We're starting to see in some serious conditions this movement called participant-led research. And that's where patients themselves organize, very frequently online, and they use validated tools to collect data about themselves. That might be a questionnaire, or it might be a device like a Fitbit. It might even just be things like weight, or blood pressure, which increasingly people can measure themselves. And they want to pool their data and try an intervention of some kind. Now, at the more sort of scary end, it could be people trying to take prescription drugs off-label, but maybe at the more benign end, they all want to maybe get together and lose 10 pounds, or try and cut out a particular part of their diet that they don't think is healthy. I personally think that's very interesting. I think what we have to be careful of is making sure that people aren't self-experimenting without the knowledge of their physicians. And in particular, I think we need to be very sensitive to the fact that there have been areas where, again, these quacksters and scammers and fraudsters try and give the impression that when you take their magical cure-all, you're part of a study. That's frequently not the case. Where patients are self-experimenting, though, I do think they frequently come into it with their eyes open. And many patients have been professionals in their lives. They've been software engineers or lawyers or researchers, whatever. They are perfectly capable of building out research projects that may be a little rudimentary. Frankly, much of the literature is rudimentary. But I think they're getting better. And they're getting better at a faster rate than one might ordinarily expect. the sensors that are available to them are developing faster than I think people take credit for. We hear about new things like the Apple Watch, which has got built-in heart sensor data. Pretty soon your average consumer with a $350 watch is going to have better data about heart rate variability, for instance, than a cardiologist would, because this data is being collected outside of the hospital visit. No, of course it's not spinal fluid in an MRI. It's not that type of level of evidence. But I think for certain questions, participant-led research offers a lot of possibility. So I think we have to be conscious of the fact that these different cohorts of patients that come through the clinics, vary every 4 or 5 years. A young woman diagnosed with MS in her early 20s has never known a time without ubiquitous broadband and high-speed internet in the palm of her hand. And so she'll have a certain level of expectations. She can bank online, why can't she see her medical records online? She can track her runs on Runkeeper, why can't she track her walking and use measures that are really out there in the real world, as opposed to walking up and down a corridor for 25 feet. And I think it's really our role to answer that with the research that we do. One thing that I've been a little bit disappointed by, frankly, is the lack of engagement with consumer technology that people have in their homes to really put those tools in people's hands. We have weighing scales in people's houses, and so they can take responsibility for their weight. But if we don't give better outcome measures and better measurement platforms to patients, how can they be expected to manage their own condition better?